It has just come to light that 95% of coronavirus fatalities are in people with comorbidities. Pre-existing chronic diseases such as obesity, heart disease, hypertension, asthma and diabetes that can be prevented, treated and in many cases even reversed with a healthy, whole foods, plant-based diet. But what if someone with one of these comorbidities succumbs to the virus before making the change? Here is a re-upload of Dr. Baxter Montgomery being interviewed on the recent Fairfax Virtual Veg Fest. The link to the original video is in the description box below.
I understand that you've actually been treating a number of patients who have had COVID-19.
That's correct. Just to give your audience a little orientation, I'm a private practice cardiologist and I practice in Houston. We have the largest medical center in the world and we see a lot of patients with lots of acute illness. And so my standard practicing patient with cardiovascular disease and related disorders, diabetes, hypertension. When the COVID pandemic developed and progressed, and we got to the point where we started closing down institutions and even medical facilities started going on reduced care. So we stopped doing elective surgeries, elective procedures and like, and started gearing up for potential coronavirus illnesses. So our practice, which was typically very busy with cardiac patients, started reducing the office-based number of patients. And we started having an increased number of telephone visits. And so a number of our patients, who, of course, during the flu season have flu-like symptoms, were calling in. And of course, we were going through the usual process of screening them. We do a telephone screen, patients in the office, everyone got a screen, a questionnaire screen at the front desk. Anyone with any suspicious issues were masked. And then we did further evaluations with temperature measurements. One particular patient of mine, a gentleman with congestive heart failure, I was doing telephone visits with him. He clearly developed overt symptoms, significant fever up to 102, severe headaches and the like. And so his condition was progressing. So we managed him at home for a period of time. During that time, we have a protocol that we use that we've always used for patients with viral syndrome. So we didn't change that with this condition. We tend to put patients on a detox regimen. We increase the amount of antioxidant foods that they consume. We then, on a case-by-case basis, we may add supplements to that. So in that context with him, we added vitamin C. We had him take zinc supplements in addition to doing raw salads and smoothies. There's a immune boosting supplement we use, grapefruit seed extract. We had him take a certain amount of that for a couple of days. This is a regimen we use with success. Typically, if a viral syndrome sets in for about 48, 72 hours, it may take it longer to be suppressed. Patients who start this regimen at the first sniffle, maybe the first cough, they may suppress their illness right away. His condition had set in for a while when we started this, so he had a bit of a protracted illness. His illness got to the point where I think after day 8, he continued to have headaches and fever. He didn't get worse, but he wasn't getting better. So I recommended he go to the hospital. So we brought him into the emergency room. The chest x-ray showed that he had double pneumonia based on imaging. So we admitted him. The pulmonary team, and along with myself, took care of him. But his initial oxygen saturation was 93%. While in the hospital, we continued with the superfood regimen. He did not consume any processed foods. He may have had one slip up at home. With this regimen, and it was my interpretation, by the time he got to the hospital, he was starting to sort of plateau. And so after being observed for about 5 days, he had a full recovery and was discharged home. Follow-up with him as an outpatient. Of course, he became afebrile while in the hospital. Upon being discharged, his headache went away, his energy picked up. He had a subsequent initial COVID test was positive, so he was, infected. A subsequent test was negative. We've yet to test for antibodies. We plan to test for antibodies in our office pretty soon, and I suspect he should be IgG positive for COVID, so he's should be immune. So this is one example of a patient who went through the process, and with natural high-dose antioxidants, some immune boosting nutrients, he was able to turn the corner. And his immune system is really what treated the disease, cured him of his illness. And that's really the point I like to emphasize. And some of the points I've emphasized before is that our cure, and I'll use that word, our cure for infectious diseases of any type is a healthy immune system.
Now, this guy was obviously extremely lucky. The best course of action is to start eating a whole foods plant-based diet immediately to hopefully prevent contracting the illness in the first place. Augment this with other healthy lifestyle habits such as good sleep hygiene, moderate exercise and keeping stress to a minimum, and you'll be in the best shape possible. Now click this.